why these numbers, because we can get this information in terms of the numbers, but we don't always know why. And some of the things they talked about were missing the time in the school year when sexual health education might be provided in school, or not necessarily having the language skills to be able to participate in that. So not getting that information. There's also, they talked about there being potentially a cultural stigma in their family or their culture of origin around using birth control or being sexually active as it is. So even though it was a pretty small number of young people who were sexually active, just under 10% for girls in the most recent survey and about 16% for boys, it's still, for those who are sexually active, they're not using birth control, or they're not using condoms, or what would be ideal, using both. They also talked about not necessarily having access, knowing where to go to get the kind of sexual health information or resources to be able to protect themselves.
And when we look at those numbers compared to their Canadian-born peers, what do we find, Daniel?
So they are, even though, as I mentioned, the migrant youth are having sex less frequently, or the percentages are lower, we do see that the use of contraception is, among sexually active migrant youth, is also lower. So we're seeing, and that's especially true for birth control pills. Now, condom use is also lower. And one area that we looked at was the use of something called neither method. So the last time a migrant youth had sex, they didn't use condoms or birth control pills. And we do know that the dual method, when you use both the condoms and birth control pills, that's the most effective, safest way. And we found that, unfortunately, for migrant boys in particular, last time they had sex, the rates of using the dual method are lower, and the rates of using neither method are actually higher. So that's kind of some of the findings that we have.
And Elizabeth, you mentioned some of those barriers and gaps that exist and some of the reasons for that. What's being done to address some of these gaps and trying to bring these numbers more, I guess, together more?
So part of it is actually providing this information for schools to encourage them to focus on maybe more culturally relevant sex ed, and ensuring that for those newcomer students who are coming into the school system perhaps at a different year than when the sexual health education begins, that there's some catch-up sessions so that they have those opportunities. It's also a real reminder for healthcare providers that they need to ensure that they're providing good assessment and providing information, and providing that youth-friendly, confidential healthcare that young people say they need, and that we've seen over many years is effective in providing young people with the information to make those healthy decisions.
Daniel, sometimes it can be somewhat of a taboo subject. You may not want to raise it with your parents or with your teachers. And if there are, situations where there are gaps, or there's, a cultural situation where someone isn't comfortable coming forward to talk about these sorts of things, what are some solutions to that?
Well, I will draw on the wisdom of our youth advisory once more. And one of the things that they told us was that it's important to challenge the stigma that's associated with contraception use among migrant youth by normalizing these discussions about sexual health with families and in schools. So I think normalization and kind of the destigmatizing is an important component to this.
Elizabeth, we've seen in some places, including Saskatchewan, parents have a choice about opting in to an out of sexual health in schools, education. What impact would that have on this?
So one of the things we know is that if young people aren't getting comprehensive, medically accurate sexual health education in school, it doesn't mean they're not getting it. They may be getting it from TikTok, which is what the advisory said. And unfortunately, that kind of information is not necessarily accurate and may not give them the kind of information, like information about consent and about being able to avoid circumstances where they might be placed in an unsafe situation. So it is helpful. And I think, one of the things parents may not always know, especially if they're coming from a country where we don't talk about this very much, then they may not know that the evidence shows having this information, having accurate information, and an opportunity to talk about your values in school actually helps reduce these unwanted behaviors or unsafe behaviors, and helps young people make the decision for when is the right time to begin to be sexually active.